Hey everyone, welcome back to my YouTube channel. If you're new here, my name is Brandon. I'm a neuroscience ICU nurse here in Rua, New Mexico. I'm a travel nurse, and right now I am in my second semester of year 2 in my acute care nurse practitioner program. And here's everything I did in week 5 of that semester. So I do want to start off by saying my apologies for not keeping these videos up to date weekly as I promised. I went through a very hard time. I lost a patient for the first time in my career, and I just went dark. I didn't know what was the purpose of becoming a nurse practitioner when we clearly failed this patient. The person fell through the cracks, and I just didn't feel like going to school. So that's why I wasn't giving any updates on what was happening in school, because I actually did miss school for a week. But here's everything I did in week 5 of my second semester of year 2 in my adult and gerontology acute care nurse practitioner program. So for that week, for my core class, which is the care for the acute and complex chronically ill patient 2, I had to participate in 2 grand rounds. And again, grand rounds is where a patient presents either to the ER, more than likely to the ER, or you get paged to the ER, and then you work that patient up. So you get a chief concern, their H&P, history and physical, and that whole process, and then you admit them, get their diagnoses, your differential diagnoses. So that's grand round in a nutshell. And then my peers, 2 of my peers were presenting. One had a patient who come in with abdominal pain, and the other one had an HIV patient. So we had to participate in that. So our peers present the case and their assessment and plan what they're gonna do for this patient. And it's like an open discussion thing where we add suggestions, question medication remedy, why not this instead of this? What's the guidelines? So that's the purpose of Grand Round. So we had to participate in 2 of those. Also, I had my GI quiz. I will put it on screen here. I'm doing okay with my quizzes so far, but I need to do a little bit better. And I'll go more into details on how our questions are. Right now, I haven't had a real exam per se since like my first semester in advanced pathophysiology when we had exams. But I had that GI quiz. We also had to complete our GI workbook and our GI imaging book. So we get workbooks in our program that are like 20 to 30 pages, depends on the topic, and you complete those workbooks. And it's pretty intense. So we had to do 2 of those workbooks. So I completed those. After that, I missed my simulation, so that thing happened. So I had my last simulation for the semester, but I did miss it, but I'm gonna make it up sometime in the future. So pretty much that was everything we had to do for that class in week 5. And for my systems thinking class, or my DNP project class, we got a bunch of feedback, proposal, open loops. It's more like planning meetings, honestly, for your DNP project. And I think I need to make completely separate videos going over really in depth the DNP process, because it is a lot and a lot of students get lost and confused. Even I get confused sometimes, but I'll really try to create some stuff to make it clearer. But for that week, it was a lot of feedbacks on our proposal, rewriting our proposals, what is our SWOT, our aim, or it's like a research paper. So pretty much that's everything I did in week 5 of my second semester of year 2 of my adult and gerontology acute care nurse practitioner program. See you guys next week.